Well, my name is Ellen Catalinatto, and I was a midwife for about 25 years in New York City. I first heard about midwives when I was 19 years old and a young bride and pregnant. And my husband's aunt, this was in 1962, 63. My husband's aunt told me that her son had been delivered at home by a midwife in 1933, and that midwife had been her own Aunt Josie, who was from Sicily, but went for formal midwifery training in New York City sometime, I don't know, in the 20s. I thought, well, that's interesting, but kind of weird. I mean, normal women go to the hospital. And I was very lucky. I went to the clinic at New York Hospital, and they were actually teaching prenatal classes back in those days, which was kind of, I think they were a little ahead of the curve. And I also had a friend who had given me a book on painless childbirth and, had recently had a baby. And I was, like very inspired and, very young and thought, oh, I can do this. And another thing that was very lucky was I had a wonderful nurse who was with me the whole time. And I now realize my daughter was born at about 3:30 in the afternoon. The nurse must have stayed past her shift to stay with me for the delivery, because they usually go till like 3:30. And when they brought me to the delivery room where my husband was not allowed, the anesthesiologist, without asking or explaining, just started putting the mask over my face to put me out. And I started screaming, and the nurse said, no, no, she doesn't need that. So I was able to be awake for the birth of my daughter. And it was a very powerful, transformative experience. I had another child, my son, like 15 months later. And, then I kind of forgot about all that till around sometime in 1970 or so. I came across an article in a magazine just by chance about modern midwives. And it was like this light went off. And I said, that's what I want to do. That's what I'm meant to do. And that started me on a long path to my career as a midwife. Well, I graduated from midwifery school in 1983, and my first job was at Lincoln Hospital in the South Bronx, where I also worked for MIC. And again, I was so lucky. I had a wonderful chief midwife to kind of nurture me and bring me along in those early years. And it was also a very busy place, and I got a lot of experience very very quickly. And I worked there for 8 years. I needed to go someplace that was not quite so desperately crowded and underfunded. I actually worked for Frances Thatcher, was my chief midwife at St. Luke's Roosevelt. From there, I was recruited to an HIV program at Presbyterian Hospital, and I think that was one of the highlights of my career. I was part of the team that both researched and gave clinical care in the early 90s to HIV infected women, and participated in the research that led to the first breakthrough in prevention of mother-to-child transmission. So that was very, very gratifying. I also loved working with teenagers, both at Lincoln and at St. Luke's Roosevelt. In both places, there were after-school clinics. So first you go to school, and then you come for your checkups for pregnant teenagers. Although I'm very happy to see the teen birth rates are going down, down, down. The first birth that I did for one of my HIV patients, I was on call and they called me in, and I got there just in time for her to start pushing. When babies are born, there's usually this feeling of joy and relief and all mixed in together. But when I gave the little girl to the mother to hold, it was as if I could feel the mother's mixed emotions. Well, do I dare to love this baby who could, who could die? Will I be around to see this baby grow up? It was very powerful, very powerful. Well, in midwifery, there's many challenges. There's the challenge of taking life and death responsibility for your patients. There's the challenge of work that's also intensely physical. We're up at all hours of the day and night. We're in motion. We try to tune into the emotions of our patients. We can work in very busy clinics where, the patients just seem to be coming one after the other, and yet we want to focus on each one and give her the best possible care, knowing that there are many others also we also want to give them to. I think some of the biggest challenges have not so much been with patients, but with the misunderstandings, the prejudices against our profession as a whole, the lack of a seat at the table in maternity care, and of course, being a midwife almost always overlaps with being a woman, so it's all mixed in together. The challenges that I faced in that review were not so much towards me, but towards my profession and towards, my gender. Towards the end of my career, there was a big attack, really, on the midwifery service where I was working. Within the span of about 2 years, it went from more than 30 midwives to less than half that number. I remember on one day, 2 midwives, each of whom had been working there for almost 20 years, both resigned because of the way we were being pushed out. And after struggling against it for several years, the atmosphere just became so toxic that I also had to leave, and that was very sad. I retired early, and I very much missed the work that I'd been doing for so many years. I've been involved in midwifery affairs. I had the opportunity to go to the 2007 International Confederation of Midwives in Argentina. That was a wonderful experience, meeting with midwives from North and South America. I've been following the whole increase in C-sections. I went to the NIH conference called cesarean section on maternal request, which is really a horrible misnomer. It was more like cesarean section on being frightened and manipulated into demanding it. And I've written on that, and I continue to, I'll go to health fairs and talk about midwifery as a career, and I love it, and it keeps me in touch with my profession. I hope so. There's a pendulum that goes back and forth, and just recently, ACOG, the American College of Obstetricians Gynecologists, issued a paper on preventing primary cesarean that had included many of the things that midwives have been saying for years. Labor doesn't go by the clock. Active labor doesn't start until further along. Like I said, midwives have been saying these things for years. I hope they get more recognition. I hope our profession gets more recognition. There seem to be some places in New York City that have large and thriving midwifery services, and other places where the midwives are kind of being pushed out. The heart of midwifery is guiding women through labor and birth in a safe and respectful and empowering manner. I'd say that's the heart. It was a balancing act. It was a balancing act. I got a lot of support from my husband, but there's always a struggle. I didn't have young children. My children were older when I became a midwife. I really have the greatest respect for midwives who work all kinds of endless hours and are on call forever. And I think it's wonderful, but, I couldn't do that. I miss the moments where the baby takes its first cry and you hand the baby to the mother, and the mother reaches out and just enfolds her child, and her pain and distress and fear are converted, well, they dissolve, and there's just this awe and triumph, as she takes hold of this new life that she's brought forth. Those are very, very special moments. There's not an awful lot like that in life. It was wonderful to have had that. Wonderful. It's been a very deep way of connecting with women. I felt useful. I felt that my education and all my talents and my personality were being used in a very meaningful way. And that was wonderful. Not everybody gets to do work that's so satisfying and gratifying. I also liked the respect that I got. Not from everybody, but from enough people. Working with so many different kinds of people, not only the patients I took care of, who included, immigrants from around the world and all kinds of women, but my coworkers in the hospital, my sister midwives, most of all. But just being in that mix of people, it was wonderful to get up every day or in the afternoon to go to work at night and feel prepared to do the work and ready to see what was coming at me. Every single day before going into labor and delivery, there's other parts of midwifery, the prenatal care, the family planning care, but every single day of my life before going into work in the labor room, I would review, I had 2 sheets of paper reviewing certain obstetric emergencies, and every single day I would read through those, just to be prepared. Even after many, many years, the papers finally started, crumbling, so I had to Xerox them. I always wanted to be prepared. In my personal life, I was very much influenced by the women's liberation movement of the 60s and 70s. And as some of that kind of became diverted from lifting women up together to kind of breaking the glass ceiling for a few, I found midwifery was a way to work with women that was both very one-on-one and personal, with a lot of, touching and communicating, but also that was empowering to women in general. I think one of the most interesting experiences I had as a midwife came when a psychotic woman was brought into the hospital where I worked. She wouldn't let anybody come near her. She didn't believe she was pregnant. You know, the doctors were all stumped. She wouldn't let them do a vaginal exam. And having learned from Lily Shaw, always ask the patient, I simply said to her, "Hi, how are you feeling?" to elicit from her what the problem was. And she had, "Oh, I have a terrible stomach ache." So by finding out her perception, I was able to address that, her stomach ache, and care for her. And she safely delivered a baby boy, not conventionally. She gave birth on the floor in the hallway. Very little help was needed from me, but at least she wasn't like tied down like an animal. It was as if hundreds of years of midwives who for centuries never did pelvic exams because that was too dangerous in terms of transmitting infection, but all their skills of palpating the baby from the outside and listening to mother's needs, it had all been transmitted to me, and I could use that in that moment. You know, that was also, I think, one of the highlights of my career.